All right, guys, we're going to go ahead and get started. Hope everyone out there has been staying healthy, handling this quarantine okay. My name is Dan. I'm a physical therapist working out up at the Wilmette Clinic. Thank you to everyone who is here, and for those of you who have been part of our last few webinars. I've been a panelist on a few of them, and they've gone really well. I think they can be really beneficial, especially for those of you who were in treatment before this all started and aren't able to come in now. Today, we're going to be discussing the active release method that we use here at React. And then after I give a little background on what it is, we'll kind of go through a demonstration together where you guys can participate with us in performing the self-releases. We also have Franco here as a panelist. He'll be monitoring the chat room. So if anyone has a question during all this, you can post that in there. When you have a question, try to address it to all panelists and attendees so that everyone can see your question and everyone will be able to see the answer as well. If anyone has any technical issues during any of this, where it's difficulty hearing or anything with the imaging, just let someone know in the chat and we'll make the necessary adjustments. We're going to go ahead and get started. Hopefully all of you can see my screen here. So again, we're going to be going over the active releases and the purpose of why we do them. So first, active release, what is it? So this is something that a lot of us, a lot of the clinicians here at React use on a day-to-day basis. It's a technique that targets adhesions or tightness within a muscle that are preventing that muscle from contracting and lengthening properly. So those adhesions can also limit blood flow and proper nerve firing, and eventually lead to poor alignment and posture and even pain. So our goal basically is to break up those adhesions or the knots within the muscle so that the extensibility of muscle will improve. So it can contract and lengthen the way we want it to, and eventually that'll lead to more effective firing of that muscle. And it will also improve the circulation of that tissue in that region, and just know that greater circulation leads to faster healing. So I have a link at the bottom here that's a link to our blog. For those who are looking a little bit more in depth of a background on what active release is, kind of at like the cellular level, you can go ahead and check that out after this. One of our PTs did a really good job of explaining kind of what it is and why it works. But for the purposes today, we're going to basically just talk about why we use it. So for most of you who have had active release, it's because they come into clinic with pain, right? So they're dealing with muscular pain, a muscle that's just really tight, and tightness won't really be relieved with stretching or anything else. Or you might be having some joint pain where the muscles around the joint are really tight. We use active release to basically, limit that pain and the guarding. Another reason why we really like it is its effect on posture. So for those who've been assessed in clinic, you'll know one of the first things we look at is your posture in standing or sitting position, looking kind of see what your hip position is or your pelvic alignment or whether your shoulders are elevated or tilted on one side. Basically, we use that assessment to identify muscles that are pulling on those bones in different ways. And basically, by relieving those muscles, it'll put those bones at a better alignment. And then we'll look at your movement patterns and your mechanics. So, we'll watch you walk, we'll watch you do a squat, basically to see, identify what muscles may not be working the way we want it to, that are leading to poor movement patterns. So just because you're not in pain doesn't mean that, if you're running or you're weightlifting, you're doing it correctly with proper mechanics. So we want to identify those deviations in your mechanics before, you even start having pain. So all these kind of play off each other. You can, from bad posture, you can have pain, or you might have a bad movement pattern because of pain. So we're going to kind of address all these in clinic via this active release method. So we'll start with pain. Pain can occur anywhere from, a trauma, a sports-related injury, a fall, any movement or contact that results in an injury to bone or soft tissue. When we experience pain, we begin to move differently to avoid motions that aggravate our pain, right? We kind of compensate out of pain. And our muscles kind of learn to do that by a mechanism called guarding, where the muscles around that site of injury or in that limb become really tight because they think if they allow that joint to move or your arm to move one way, they think it's going to cause increased pain. So they learn that if they stay really tight, they'll kind of protect you from that pain. But what we want to do is get those muscles to relax so we can get you to move the way we want it to. So a great example is if you sprain your ankle. So if I step off a curb and I turn out my right ankle, that's going to result in pain and bruising in my ankle. And in the following days or even weeks, I'll stop putting as much weight through my right leg. If I move my ankle around, it'll kind of hurt if I point it or turn it in. Those are those muscles that are guarded that are trying to prevent you from doing that because they think it's going to cause an increase in that pain process. And what happens is if we're not putting enough weight on our right leg and we're not, walking correctly, the muscles that, allow us to move correctly aren't going to turn on because they don't need to. We're not putting as much weight through it. We're not letting our leg kind of move in front of us or behind us the way we want. And the muscles are, one, they're going to shut down. and then they can become really tight. So what active release allows us to do is, one, turn on those muscles that aren't doing enough, like your glutes or your quads, and relieve that tightness in them. And then also, you know, if you sprain your ankle, the muscles around can be really tight and painful. By addressing the tightness in there and that guarding, it'll allow to move your ankle a little bit more freer. Another example that we like a lot is posture, right? So we kind of all suffer from bad posture. A lot of us sit throughout the day. So, you know, when we're standing, our hips are a good example. So when we're standing, our hips are in neutral alignment. If we go and sit down, you know, our hips are all the way up at 90 degrees, a pretty significant difference from neutral. And we're staying in that sitting position and that hip flexion for extended periods of time. So you see in the picture I have here on the top left, these two muscles that come from your spine, that go to your hip, and the inner pelvis go to your hip, those are your big hip flexors, your iliopsoas. So if you think if you're sitting, those muscles are in a lot shortened position. And when we're sitting for those extended periods of time, those muscles aren't going to be able to stretch as well. So if you're sitting for a while and go to stand up and it feels really stiff or even hurts, usually it can be because those muscles just aren't used to become lengthened. And then what happens too is if your hip flexors are really tight, your hip extends, you're not going to get as much hip extension. And most of you know your glutes are responsible for that hip extension. So if we're not getting that motion, our hip extensors aren't going to turn on, and that's going to lead to instability and poor posture and can lead to pain, like we said before. So as it says here, by releasing your hip flexors, one, it's going to improve the extensibility of those muscles so that you can have a little bit more free motion at your hips. But it's also going to allow for greater firing of your hip extensors because you now have that motion because we released the muscles that were preventing you from having that motion. So for those of you who've been in clinic and we get you on your back and we kind of dig in on the inner part of your pelvis or kind of in your abdominal cavity, not the most comfortable thing in the world, but those are your hip flexors. And, you know, we find those are really important to free up your motion so that you can get that hip extension. We can get you in good alignment. Shoulders are another great example. You know, a lot of us, when we sit for a while, our shoulders are elevated up towards our ears. Our head's forward, our mid-back is kind of hunched because we're fighting gravity. Gravity kind of always wins, and to have good posture, you almost have to fight gravity. So what happens, another picture I have up here, is when we have that forward head posture and we're hunched forward, the muscles in the front, like your pecs and the muscles kind of in the upper neck are really tight. They can be really achy and sore. And eventually they become so used to being in that position that they're not going to let you open up into that good posture. And it's not going to allow those muscles that are in the lengthened position you see here where it's really weak, they're in that lengthened position and they're not going to turn on. If we don't achieve good posture, those muscles aren't going to turn on. So same idea, we'll kind of dig into your pecs and those upper trap muscles so that you can achieve that good posture. And proper posture puts you at a more advantageous position for those weaker muscles to fire. So again, posture is huge. We stress it all the time, and active release can allow us to achieve that good posture almost immediately. And then lastly, we'll kind of talk about movement patterns. So regardless of what is causing the poor movement patterns, whether it's the tight muscles, pain, posture, the body has to adapt, right? It's going to compensate to achieve the activity you want to do. And our bodies are always going to take the path of least resistance. So if doing the bare minimum allows us to complete a task, our body's going to comply. So meaning if we can get by using a few muscles rather than all of them, our body will do that. And it's not going to fix it for us. That's when we kind of have to get in and get us moving the correct way. So again, what happens is over facilitation of those muscles that are picking up the slack for the muscles that aren't firing. So for those of you who have issues with rotator cuff tendonitis or kneecap pain from those tight quads or piriformis syndrome in your hip, those are examples of muscles that are just doing too much. They're over facilitated, and eventually they've just kind of accepted that they're going to do all the work to complete a certain task. And that's when we start getting pain after activity. So what active release allows us to do is to turn off those muscles that are being over facilitated so that we can work on activating muscles that are weaker, that haven't been turning on. It almost resets the system. So an example we see a lot in clinic are kind of the relationship between your hamstrings and glutes. So, you know, a lot of us don't use our glutes properly, mostly because what we talked about before, we have tight hip flexors because we're sitting a lot during the day. So if your glutes aren't working, someone's got to pick up the slack for that hip extension motion, and our hamstrings tend to do that. So our hamstrings are doing what the glute does, then also doing what the hamstring itself should do. So to get your glute to fire, what we can do is release your hamstring or turn off your hamstring so that your glute is in a better position to fire. And that's when we get into those activation exercises that some of you have done before. So really, we just want to reset the system and get you in a position and get your mobility back so that all your muscles can fire. So just a quick review, active release, one, it's going to decrease muscular guarding at the site of an injury, which can lessen or even eliminate your pain. It's going to improve the extensibility, the flexibility of those overly tight muscles, resulting in greater motion of that muscle and at the joint itself, which is going to allow for more effective muscle firing. It's going to restore normal posture and bony alignment, which is going to provide your muscles a greater opportunity to activate. So if you're elevated on one side of your shoulder, or your hips really tilted forward, if we just turn off those muscles or release those muscles that are pulling you in that alignment, it can restore proper alignment, and it's going to be easier for those other muscles to turn on. And then lastly, like we just discussed, it's going to eliminate those faulty movement patterns, get you out of those compensation patterns where you're avoiding pain, so it can allow your muscles to work as one whole unit. So a lot of my patients ask, when is the best time to do active releases? As far as, during your home exercise program or if you're doing an exercise routine. And really the more the merrier. If you're within a rehab program now or you're training for, a marathon, something like that, you really want to do about once a day, but ideally before activity, right? Because, by doing the releases, the goal is to get you in better alignment, to make sure all our muscles that we need to accomplish a task are firing properly. So you want to do those beforehand so that you can go in and go ahead and then go focus on turning on the muscles we want to. So it kind of puts you at a good position, a good situation before doing activity. Another benefit we find is for those who have a lot of morning stiffness. If you wake up with back pain or your knees feel really tight, we find, if I give patients these self-releases, if they do them in the morning, they'll find that they'll get into their daily routine quicker because those joints or those muscles loosen up faster, so that they can get into their daily routine. And then if you're out of alignment, so we're not going to necessarily get into talking about how to look to check if you're out of alignment. That's been discussed in a couple of the past webinars. But if you know how to check for that and you notice, one hip is a little bit tilted, you can use the releases to see if that can correct it for you. A lot of people ask, shouldn't I only do the releases when I'm in pain? Not always. You can make a strong argument that active release is more beneficial in injury prevention and pain prevention rather than as a treatment for pain itself. So if you're a runner, don't necessarily wait for your knee to start hurting to start doing the releases. Make that, an essential part of your exercise routine as soon as you start your training. Do it before your run, and you'll notice you'll be in less pain before and after, and during. And I think you'll see that you'll make gains quicker during your training process. And then post-activity, people ask a lot too. Again, you can do them after activity. That's one where I would let pain be your guide. So if you feel pretty good during a run or during a weightlifting routine, but then afterwards, your shoulder's tight from lifting or your calf's really tight or hurting afterwards, then yeah, go ahead and do the releases because that should limit that tightness or that pain that you're experiencing afterwards. It can have immediate effects. So next we're going to kind of go through a demonstration. I'll give you a demo on a few of the releases that I use most often in clinic. Just remember, one, that this webinar is being recorded and will be available to you afterwards. So if you feel like I went too fast during one of the releases, it will be available later. And then all of these releases, the ones I go over and all the other ones we do, are available on our React YouTube channel that our trainers or other clinicians do another demonstration. It might be a little bit different than the ones that I show you today, but all of them can be beneficial. So hopefully with you have a lacrosse ball. That kind of tends to work best for the self-releases. If you don't have one, though, you can also use a golf ball, a baseball, a tennis ball, just something that's kind of like that size and firm so it can kind of dig in on those muscles. And then today I'm not going to be going over any specific foam rolling techniques. I know a lot of people like those, but if there's someone who has a question at the end that you want me to review on, I can certainly do that if I'm familiar with that technique. So before we get started, just a quick guide. When you're targeting a specific muscle, you're going to kind of want to fish around for a hot spot within the muscle. So like an area with increased soreness. You might not always find one within the muscle. Sometimes people try to push too hard or really find one. They don't find it. That doesn't necessarily mean you shouldn't perform the release there. Sometimes you just get used to performing the release, or, there's just not as much sensitivity there. It doesn't necessarily mean the muscle's not tight. So, it obviously depends on what your therapist prescribes for you to use, but don't necessarily think it has to be really sore. You want to spend anywhere from about 30 to 60 seconds on a muscle. Ideally while doing the release, you'll feel that muscle kind of relax as you go, or you'll find that your range or smoothness of motion improves. But you don't necessarily want to spend more than 60 seconds on a muscle. You can always just kind of fish around for a different spot. And then you can just go on to the next one. And a big thing too, try to stay relaxed throughout your body. You may find some muscles that are really tight, and it's kind of pretty uncomfortable. Try not to tense up your whole body as you do it, because that can delay that muscle from releasing. And then most importantly, just be patient, take your time with these. Proper release techniques can be a huge contributor to achieving your rehab and exercise goals. So the same way you don't want to rush through an exercise routine, you don't want to rush through releases. You want to take your time and ensure that you're doing them correctly before going into your training routine. So I'm going to pop out of this presentation here. All right, so hopefully you can see me here. So what I'm going to do next, if everyone wants to grab their lacrosse ball or whatever they're going to use, something kind of like this that's pretty firm. I can also see the chat now too, so if someone has questions about what to use or anything, me or Franco can help address those questions for you. We're going to go through about 10 muscles here that we kind of use most often in clinic. And I'll try to take my time through them, and if you feel like I'm going too fast, just let me know in the chat. So the first few that we're going to do are kind of upper extremity ones. So the first one we have here is your upper trap muscle. So your upper trap muscle is a muscle that most often what it does, it elevates those shoulders. So when we're sitting at a computer, eventually our shoulders kind of raise up towards our ears, or when our shoulder hurts, we kind of use that upper trap muscle as a protective mechanism, because our shoulder just feels more stable when it's up towards our ear. But really that's doing the opposite of what we want it to do. We want that shoulder to kind of relax down. That's going to free up your lat and those muscles in the back of your shoulder blade. So what you're going to do, this is one way to do it. Again, on the YouTube channel, there's other ways to do it, but for the benefits of the webinar, I'm going to do it like this. So you can take it, let's say you're having left shoulder pain or left-sided neck pain. You're going to take the ball with your right hand, and you're going to put it, kind of find your shoulder blade here, and you're going to kind of go right above it. You're going to kind of dig in to that area that's really sore. Again, like I said, you're going to kind of fish around for a hot spot, kind of push down, and then when you find that tender spot, we're going to move our neck. So it's active release. So we're moving that muscle and lengthening, contracting that muscle as we go. So one, if you find you're really tight going down, we'll go up and down nice and slow, back and forth. Again, we're not going to do the full 30 seconds here with all of these. That's just going to take too much time. But as you do this, after sometimes it's 15 seconds, after about 15 seconds, you might feel it release. If you don't feel as tight going this way, you can turn your head all the way to the left and back. Some of you are tight this way. You can move your ear to the shoulder. Basically, by putting pressure on that muscle and then making it move, contract, and lengthen, it's going to teach that muscle that it's able to move, and it's going to free up your motion more when you look up and to the side. So that's going to be one of them. That's a big one for anyone who notices they hunch at their shoulders a lot and feel real tight this way or get kind of upper neck pain. That's one that's going to be very beneficial. The next one is your pecs. So again, just for the sake of this, we're going to do it here. Your pecs is a pretty big muscle, attaches from your sternum here, up at your collarbone. It does attach to your shoulder blade and then to your inner arm. So you can really find it anywhere in this region. What we want to do is identify that pec minor, which is a real smaller muscle, but it's kind of in the corner of your shoulder here. So sometimes you have to dig in pretty hard. But once you fish around for a spot there, you're going to take your arm to the side, and you're going to move it all the way back and move it all the way forward. Again, with all these, it might be sore. You might even have some referred pain, like you find like a little trigger point. You may get some pain towards your shoulder. It should be dull. It shouldn't be anything where it's really sharp pain. But I would work through that, and you'll notice as you go, that muscle will relax. You'll be able to move your arm further back. And it can even have benefits to your neck range of motion and your mid-back range of motion. But the idea is, one, that shoulder won't be so tilted forward. I see a question there. It says, "Is it okay? Do the exercise if you hear clicking noises?" You can work through clicking as long as it's not like a painful pop or a painful clicking. That's just instability at the shoulder. Clicking can be an indicator that your shoulder is unstable. It's not moving the way we want it. And a lot of times doing releases will decrease that clicking. A lot of people's shoulders click a lot. As long as it's not painful, it shouldn't really do any damage. But you can just do smaller ranges of motion if it bothers the clicking too much. You can bring your arm back this way and forward. We're just trying to teach that muscle by adding pressure to lengthen and contract under that with pressure on it. So the next one, your external rotators, your rotator cuff. You're going to find a muscle back here. So your rotator cuff muscles attached from your shoulder blade, and they come along kind of the back of your shoulder. And you'll kind of find a spot in there. So kind of find the top of your shoulder here. You'll go down and back, kind of in between your shoulder blade and your upper arm bone. So for here, you're going to kind of go there and dig in real hard. You're going to go up and down like that. Okay. Sometimes that can be an uncomfortable position. So if it's easier, you can do rows this way. Normally the best way to do this one is think if there was a wall behind me, you kind of push into the wall. I just don't want to move the camera too much, make everyone all dizzy. But you can also, instead of using your hand to push in, you can lean up against the wall and do that. Basically, those of you who have rotator cuff tendonitis or shoulder impingement, this one can be pretty sore. You're going to want to work through that pain. You'll notice that that muscle will relax and will free up your motion more. This one too is one of those muscles we talked about over facilitation. So for those who have rotator cuff tendonitis, those muscles are doing too much. We want those muscles between your shoulder blades to help out, your mid trap, your low trap, your lats. So by turning those muscles off, you're going to find that you're a little bit stronger. It'll put less stress on those muscles that are doing too much. And then next one is your tricep. So hopefully you guys can see here. So your tricep, the muscle in the back of your arms. Most of you know kind of where your biceps are, right? It's on the front. If your palm's facing up, biceps are on the top. Your triceps do the opposite motion. So it extends at your elbow. So what you're going to do is you're going to take the ball with your palm facing towards you flexed. You're going to push down onto that muscle. Again, your tricep goes all the way up through the length of your arm. So you can kind of start, if you're going to kind of go through a few spots, you want to start higher up. You're going to go up and down, extend your arm all the way and bring your arm up as far as you can. This one is one that can be pretty sore. Also find that sometimes people get tingling in the hand. As long as it's light tingling and not really intense, you can work through it. If it's something where you're getting a lot of tingling, especially in the back of the hand, maybe that you're pinching on a nerve a little bit. So just adjust the position of where you're at. So you're going to go up and down, for about 30 seconds until you feel it release. And then if you want, you can go further down the muscle because this is one where there might be knots throughout. So you can kind of go up and down and then all the way kind of just above your elbow. But this one can be really beneficial. Triceps are a huge muscle that really do too much for us. Anyone who has, tennis elbow or, tingling in the hand, your tight triceps can be a huge contributor to that. So by releasing it, I think you'll find pretty quick effects just by turning that muscle off. So we're going to switch to where I'm at now because the next exercises we're going to do on the floor. Let me adjust the camera here. All right, so the next one we're going to get is your lats. So your lats are a huge muscle. Your lats attach from all the way down from your lumbar spine, come up all the way to your back. They attach on your shoulder blade and your upper arm in here. So there's a lot of different places you can get for your lat. What we're going to do today is basically you're going to find your shoulder blade, the outer border of your shoulder blade. You'll find it in there and you're going to go a little bit higher. It's going to be kind of right on that shoulder blade muscle, maybe a little bit in between. You're almost going to go like right underneath your armpit. What I'm going to do is we're going to do this one on the floor, but the ball is going to be about right there. And if it's comfortable on your shoulder, you're going to put all your body weight on it. Hopefully you can see me how I'm kind of fishing around for that spot. So you want to fish around until you feel a tight spot. This is one really ease your body weight onto it. This shouldn't be like, severely painful. It should be kind of like that good hurt, that hurts so good feeling. And then as soon as you get there, if you can tolerate it, you're just going to move your arm in any way that you can. So bring it kind of across your body and back out. You can do this if you want, if that motion is too uncomfortable for you. Or if moving it is, if the pain is just kind of too intense or you can't move it, you can just kind of sit on that spot and just kind of wait for that muscle to relax. Moving is always better, but it shouldn't be to the point where, moving is causing any joint pain or pain elsewhere other than where the ball is. All right, so next, making sure there's no questions. All right, so those are kind of the upper extremity ones we do most often. Again, there's a lot of other ones that you may be familiar with. You can find those on our React channel, or at the end we can go over them if there's a specific one you want to do. We're going to go on to the lower extremity here. So we're going to start with the hip flexors. Hip flexors are a really tough one to get. That was that picture where it showed where it's from your lumbar spine and your inner pelvis attaches to the front of your hip. So what you're going to want to do is find the front of your hip bone here, that front of your pelvis. When you find that bone here, this is where you can kind of check your alignment too. Those are my front of my hip bones. You want those to kind of be in line. If there's one that looks a little bit lower down, or even one where if you kind of tilt a little bit backwards and one side feels a little bit tighter, that's kind of the side you want to address. For our purpose today, we're just going to get the one on the inside of your pelvis. So you're going to kind of find that spot on your hip bone where your thumb is, and you're going to go just inside of it, okay? And what you're going to do is try to keep it in that spot as much as you can. And you're going to lay on your stomach, if it's tolerable. And you're slowly going to shift. Right now, I'm shifting my right pelvis over that ball. It's going to really push in there. Again, it's not going to feel great, but it should feel like that muscular soreness, that achiness. You're going to bend your knee up, and you're going to let your right leg fall out to the side, where you're almost tilting your body this way. So you're kind of putting pressure on that muscle, turning that leg out, and then coming back in. And again, if you don't feel like it's in a sore spot, you just kind of shift your pelvis around until you find a spot that's sore, and you're just going to do this motion, forward and back, until that muscle relaxes. You can also do this here, where you're going up and down. Basically, we're just getting that muscle to move as much as we can while putting pressure on it. That's going to be your hip flexor. That's one for those of you who are sitting a lot during the day and then go out and as soon as you get home, you want to go on a run or do a weightlifting routine. That's one I would definitely get. Your quad is the next one we're going to do. So your quad attaches at a similar spot, basically kind of right where that bone is. But your quad, as most of you know, goes down your thigh. It's got 4 muscles. So again, a lot of surface area here. You can get a lot of spots through there. We like to start a little bit higher up. So you're going to kind of find that bone on your hip, go a little bit further down. So it's going to be somewhere kind of in this region here. Same position. You're going to lay on your stomach. Slowly shift your weight onto that spot here. And your quad extends your knee. So this is flexing your knee. Your quad extends your knee. You're going to go up and down. If it doesn't feel sore, you're going to just lean forward. Let that ball go further down your leg. You're going to go up and down. Just like this here. This is one where a lot of times you can feel it release, or you can feel that the smoothness of your motion improves. But I would definitely spend time on this muscle. For those runners out there who get a lot of kneecap pain, we see that a lot in clinic. While you're running or after your run, your kneecap is really tight at the top of your knee, or pain on the outer part of your kneecap. It's usually due to tight quads. So doing the release will help, along with glute strengthening exercises. Quad's a muscle that tries to work from both ends, where it kind of tries to stabilize your pelvis and extend your knee. We want it to focus more on what it's doing at the knee, whereas your abs, your glutes, your hip flexors will stabilize your pelvis for you. So for those of you who get knee pain a lot from stair climbing up and down, from running, increased activity, quad release can be really beneficial for those. All right, so next we're going to go over a muscle called your Quadratus Lumborum. It's a muscle in your low back. So what you're going to do, it's going to be kind of hard here. You're going to find your spine, your rib cage. So you want to go below the rib cage, kind of in that corner by your rib cage and your spine. Make sure you're not on the top of your pelvis. So it's kind of a small pocket right in that corner of your low back. You're going to put the ball there. Make sure you can see me. Kind of like right in there. And this is one where if you do have a lot of one-sided back pain or chronic back pain, really go easy when you shift your weight onto it. So you're here, and you're going to let your legs come to the side and slowly ease in, putting pressure on it to there and then back. If doing that and that's too uncomfortable, you can just do one leg and go in and out like that here. Just this one, you want to be really careful. You don't want to be on anything bony. So if it feels like it's sticking into your ribs, your spine, or your pelvis, you're probably not in the right spot. Fish around for that hot spot and just try to relax as much as you can. You're going to go in and out, just like that. This muscle is another one that tries to do what the glutes do, or will do too much if your abs aren't working. So by turning it off, it can be a huge one, especially for weightlifters out there who get a lot of back pain. Releasing the tension in that muscle, you can find strength gains pretty quick. All right, next one are your glutes, your piriformis. So your glutes, it's your butt muscle, right? It's going to be right in the back. You want to kind of find your tailbone. Kind of find your tailbone. You're going to go really anywhere in your glute region. This is one where you can really fish around for a hot spot. One, it might be your glute that's really sore. There's also a lot of muscles underneath it, your external rotators, that can be tight as well. So like for those who have piriformis syndrome or posterior hip impingement, you might get a lot of soreness in here. Basically, you're going to kind of sit on the ball, and you're going to let your leg turn in and out here, okay? So when you're here, it might feel really tight on your inner thigh, but you'll see that as that muscle relaxes, you'll slowly be able to turn that knee in and out more, okay? This is a huge one for anyone who sits a lot during the day and gets pain, in their low back or in the back of their hip. By doing this, you can find, pain benefits right away. It's also huge to make sure your glutes are firing properly. Sometimes those glutes just shut off. By giving some attention and digging into that muscle, it's going to help that muscle turn on and teach it to lengthen, contract properly. Just kind of work through that soreness going in and out. This is one that I do a lot, especially in the mornings or right before a workout. I find that if you do these, or even with my patients, when you do these, you'll find you'll get better activation of that glute muscle. For any of our patients, we emphasize glute strength more than anything because our glutes are huge. They stabilize our lower leg, and if they're not turning on, that's when we get a lot of issues in lower leg pain. So last two we're going to go over our lower leg muscles. So your calf or your gastroc and your shin muscle. We'll start with your gastroc. So your gastroc is your calf muscle. There's really two heads of it, one on the inner side and one on the outer side. It goes all the way down and touches your heel where your Achilles tendon is. So this is one, anyone who has Achilles tendonitis, plantar fasciitis, or just tightness in the calf in general, and our runners. Doing this one can be really beneficial. You're going to take the ball, you're going to let your lower leg fall on top of it. Let's see if you guys can see me here. Forward a bit. There we go. So again, with some of these longer ones with more surface area, you want to start higher up, so towards the knee, proximal. And you're just kind of fish around for a hot spot, let that leg go around. And then when you feel a spot, if that feels like pretty good tension, you're just going to do ankle pumps, okay? If it doesn't feel like enough pressure and you're not really pushing anything sore, you can take your right leg and put it on top. And you're going to go up and down with that left foot. You can turn it in and out. But this one for sure, if you have plantar fasciitis, tendonitis, again, or just general tightness, this would be pretty intense. So if that's too much, just do it here. Or if that is all too much in general, you can just use your hands, okay? Dig in on a spot. Again, normally I would do this when sitting in a chair. You're just going to push in with one of your hands and go up and down. You can go all the way down to the inner and outer calf. This one for sure I would spend 30 to 60 seconds on. This one I think you will find it, you'll notice it release, but make sure you give good attention to it. Lastly, the muscle we'll go over is your anterior tib, shin muscle. You do have a lot of muscles underneath here, but our anterior tib is one that we find can become the most tight. For anyone who has shin splints, or just when you get home from a run, if you get that kind of like band ropey feeling along your shins, a lot of it's because you're holding your foot too tight and not letting it push off. This one, you're just going to take two hands, press in on that muscle. So you'll find your shin bone at the front, and you're going to go just to the outside of it. Okay, kind of like the direction of where your pinky toe is to the lateral side, and just up and down, kind of feel for a hot spot. The closer you kind of get to your shin, the better. That shin bone at the front, you go pull all the way up and all the way down. All right. If this muscle's too tight and doing too much, it can cause tightness all the way up the front of your leg. Your quad, all this is kind of connected with fascia. So if there's a kink in the system somewhere, sometimes that's our shins. By releasing this muscle, you can find it's going to free up your motion, not only your ankle, but could at your knee as well. So you're going to go all the way up and down, 30 seconds, 45 seconds to a spot. This one you might notice as you go, you're able to point your toe a little bit further, or you won't get as much pain when you pull it up and contract that muscle. So this is another one too for runners who have shin splints, who get kind of that pinching pain in the front of your ankle. This is one just simply by doing this one with the calf can eliminate that pain, at least for the start of your run. All right, so that's all we're going to go over now. Does anyone, oh, okay. I see a question already. So will you be talking about the adductors? All right, let me go back. So your adductors, that's kind of a tough muscle to get. Your adductors are those inner thigh muscles, your groin muscles. So they're going to attach pretty far up on your pelvis into the outer part of your knee. What you can do, this is one where you can kind of get a foam roller out. You can also, like, if you have a step, basically you want to get your leg like this where it's resting on top. You're going to put the ball somewhere along that inner thigh muscle. You want to stabilize it, and you're going to extend that knee and come back. This one can be pretty sensitive, especially we got a few nerves that kind of run pretty superficially close to the skin on this one, so I wouldn't go be too aggressive with this one. But a lot of us are really tight in these muscles because a lot of us don't kind of abduct our hips properly. We don't use our glutes properly, so these muscles do too much. But this is one you would do here. If you want, a lot of people like rolling out their adductors. So this is one that sometimes I give. I haven't done this one in a while. But you're going to put the foam roller up kind of in your groin there. You're going to go up and down there, putting pressure down into it, up and down. Foam rolling, I find that there's not really great indicators on when to stop, but it can be beneficial in loosening up that fascia throughout the muscle. So if you like foam rolling, you like that more than a lacrosse ball, this is kind of what it would look like here, where you're going up and down on that muscle. Let's see what else we got here. Franco, anything I missed question-wise? Oh yeah, so I see a lacrosse ball might be too intense for your quad. That's the one where, on the front of your thigh. So foam roller is another one too, where if putting that much pressure on just this surface is too much, then yeah, you can use a foam roll here, like there, and you'll go up and down. Foam rolling is a good way to, cover a lot of your bases and get more surface area of the muscle. So if the quad is kind of tight in general, we'll go up and down. You can kind of turn your leg in and out to get kind of your outer quad or your inner quad. All right, so if anyone has any more questions, please type in the chat now. I'll wait about a minute here. Otherwise, for those watching, I just want to remind everyone that all of our clinics are still open. And that you don't need a script to come in at this point still. We're direct access. So if you're working with some pain, whether it happened before all this or during, and you want to come in, you can certainly call and make an appointment. We're taking all the necessary precautions. Normally I'd be wearing a mask and gloves in the clinic. There's no one here now, so I'm not. We also have telehealth available. So if you want to do a screen telehealth where it'd be something like this, but just me and you're dealing with pain, we can kind of at least walk you through a few specific exercises and releases that you can work on until this whole crisis is over and we can get you in for an eval. So I see a few questions about stretches. On our YouTube channel, you're going to find stretches that go over those. There's a lot of different ones. And then I see a specific order through the releases. I think it's better to start, you want to go from like your trunk and then move your way out. So, if you're dealing with knee pain, I would start with the hip flexors, then go to your quads, and then go to like your calves or your hamstrings. You want to work from like your pelvis in a way, but it's not necessary. There's not a specific order, but that's kind of what we find to be the most beneficial. I see IT band with roller. Your IT band runs on the outside of your leg, on your outer thigh, opposite from your adductors, inner thigh. So you're going to go like this. This one can be really intense too. So that's why I don't give this one out a lot. But if this position's comfortable for you and you want to loosen up that band, that's how you would do it here. But that can be pretty intense. But if that's what you're looking for, this is kind of how it's going to look like. You're going to go up and down directly on the lateral side of your leg. All right, good question. How do we tell the difference between pain to work through or pain to stop what you're doing? So pain to work through is where, if you find a muscle that's pretty sore, you don't want, let's say it's like a 2 out of 10 pain. As long as you're staying in that 2 to 3 out of 10 pain, you're okay to work through it. If it's something where that pain sharply increases to like a 5 or 6 out of 10, that's when you're going to want to stop and you're going to adjust, where you're not putting as much pressure through it. Again, like I said, you might get some referred pain if you're getting a muscle in your pec, you feel shoulder pain, you can work through that as long as it's not intense. You should feel better after releases, not worse. If you feel worse, you're probably doing something wrong. Any other questions here, guys? All right, so just to say again, this recording will be available for you guys to go over if you want to go through the exercises again, and they're all available on our YouTube channel. I hope this was helpful for you guys. You're able to hear me okay, and everyone stay healthy out there.